Hello, this is Dr. David Green, Education Director at Premier Pain Specialists in Chicago. Today's topic is the basics of sciatica. Sciatica occurs when one of the nerve roots of the sciatic nerve is pinched. The sciatic nerve itself is a conglomeration of three nerve roots in the lower back, L4, L5, and S1. As those come out from the lower spine, they come together and form the sciatic nerve, which runs down the back of the leg. At any one point in time, 1 to 2% of the population suffers from sciatica, with the most common reasons being herniated discs or spinal stenosis. Less common reasons, you can have degenerative disc disease, which is inflamed and irritating the adjacent nerve roots. A person can have a tumor, or someone could have a problem after the nerve roots come together somewhere down in here. Well, how does it occur? When a disc degenerates, the outer layer can tear and part of the inner jelly can squeeze out, okay? If this compresses a nerve root, that in and of itself does not cause pain, okay? It may cause weakness, but not pain. It's the inflammation, see this red, that gets sparked up that leads to the sciatic pain that goes down the nerve root, all right? This is why disc degeneration without herniation can still lead to sciatica due to inflammation, because even if you don't have this pinching, but you have an inflamed degenerative disc, it can inflame the adjacent nerve root as well. What are the symptoms of sciatica? They'll vary. It can include a burning sensation, electrical or pins and needles sensation, maybe some numbness, less commonly motor weakness, and rarely a person can have bowel or bladder incontinence, which is a surgical emergency. How is it diagnosed? Well, history and physical examination is key. An MRI helps a lot. If necessary, a nerve conduction study or a diagnostic injection. Here's a doctor doing what's called a straight leg raise test. The leg is lifted up straight, just as the name denotes. And basically, you're pulling tension on the nerve root. So if there's sciatica with nerve root pinching, this will exacerbate it. The patient will be very uncomfortable. And then when the knee is flexed, it takes tension off the nerve root and the pain goes away. If you have that in conjunction with something like this, with a large disc herniation, here's the disc, and you have a piece of disc coming back and pinching on the nerve roots here, then that correlates really nicely. With sciatica treatment, it used to be thought that bed rest for about a week would be good, but we now know that's not true. The longer you stay in bed, the more you disuse atrophy on the muscles, and it really is just not good for your body. So as limited bed rest as possible is best. Medications may include anti-inflammatories, Tylenol, muscle relaxers, neuropathic medications such as Lyrica or Neurontin, and then opiates. Physical therapy can be very beneficial along with chiropractic treatment. Acupuncture, TENS units such as you see here, about the size of an iPod. They run off a battery. They go on your belt. And these foam pads are where it goes on your skin, and slight electrical impulses are pushed through, and it can provide pain relief by changing the way the brain perceives pain signals. Spinal decompression therapy can be very beneficial. And then interventional treatments such as trigger point injections to relieve spasms, and then epidural injections such as you see right here. Pinching of a disc on the nerve root with sciatica. This steroid injection soothes this area nicely. Well, the outcomes with sciatica treatment are that over 95% of sciatica patients are successfully treated without surgery. There was a landmark study in 2006, Journal of the American Medical Association, showing that the one-year outcome between operative and non-operative patients, totally identical. Those who had surgery got out of pain faster and got back to work faster, but at 1 year, there was no difference. Now, what are the indications for surgery? An absolute indication is if you have that bowel and bladder incontinence. That's called Cauda-Equina syndrome. That's a surgical emergency. You should definitely have surgery within 24 hours. Now, a relative indication is if you have muscle weakness. So an indication for that might be foot drop, where you have trouble lifting up your foot. Might have trouble lifting up your big toe, or everting your foot. Whatever the case may be, if it's getting worse, consideration should be given to having surgery, because presumably the nerve compression is getting worse. If you have muscle weakness that goes on for months, it's unclear even if you then have a technically perfect surgery, if it's ever going to get better. So you have to be careful. And then electively, if there's no muscle weakness, if you just have pain, 6 to 12 weeks of failed non-operative treatment, then you can consider surgery. You don't have to have it, right? But if it's just not getting any better. The top non-operative pain management in the metropolitan Chicago area is with Premier Pain Specialists. There are several clinics, 7 currently, accepting over 50 insurances, and huge success rates with the board-certified, fellowship-trained, and award-winning doctors. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-519-4701. Thank you very much for watching.